Hello and welcome to our show, Beat Diabetes. I'm Gargi Rawat. On the show, we'll be discussing managing pre-diabetes. Now, the number of individuals affected by pre-diabetes is increasing rapidly across the world and in India as well. The presence of pre-diabetes does not mean you have diabetes, but then it provides you with an option to take corrective action to reverse pre-diabetes and prevent the progression to full-blown type 2 diabetes. A better understanding of pre-diabetes can help with early detection and allow earlier interventions and potentially lower the number of individuals who go on to develop type 2 diabetes. Getting detected with pre-diabetes provides one with a window to take those corrective steps. Today we have with us eminent endocrinologists who can help you understand and manage pre-diabetes better. We're joined by Dr. Professor Ashok Kumar Das, consultant physician endocrinologist, Pondicherry Institute of Medical Science. Also, Dr. Vijay Viswanathan, head and chief diabetologist, MV Center for Diabetes, Chennai, and Professor M. Viswanathan, Diabetes Research Center. And we're also joined by Dr. A Ramachandran, chairman, Dr. A Ramachandran's Diabetes Hospitals, President, India Diabetes Research Foundation, Chennai. Thank you so much, doctors, for joining us on the program today. And Dr. Viswanathan, I'd like to start with you. If you could explain to our viewers what exactly is pre-diabetes and also how common is it currently in India?
Yeah, thank you for this very important discussion on pre-diabetes, which is the need of the hour. And pre-diabetes is when your blood sugar is higher than what it should be for your age. So if you have a HbA1c, which is a 3 months average between 5.8 and 6.4, or if you do a glucose tolerance test, if you find the fasting is a bit high or the 2-hour value is a bit high, then you are supposed to have pre-diabetes. The data about pre-diabetes in India came from a study called ICMR INDIAB study about 5 years ago. It is said that 1 out of 6 Indians have pre-diabetes, 1 out of 6. And it is estimated that about 77 million people have pre-diabetes in India. So all of them are like a volcano about to erupt and get into diabetes. So it's very important to prevent the progression of pre-diabetes to diabetes, because we already have a very high load of people with diabetes. So if all these 77 million people are getting converted to diabetes, then it is impossible to manage the situation. Thank you for your question.
Right, doctor. In fact, it is being said that India is a ticking time bomb as far as diabetes is concerned. And if you're saying, such a huge number of the population is affected by pre-diabetes, that's very, very concerning. Dr. Das, are there any specific risk factors of pre-diabetes that people should monitor? And is it possible to prevent the occurrence of pre-diabetes?
Yes. A positive family history in the parents or the first relatives, obesity, either general obesity or the abdominal obesity, the cardiovascular disease, hypertension, higher lipids, and also gestational diabetes. Diabetes occurs during pregnancy. There's a syndrome in the young girls called polycystic ovary syndrome, and the other few things like other metabolic risk factors are the pointers. Are the specific risk factors for the pre-diabetes.
All right.
And, I must tell you that yes.
Yes, Dr. Ramachandran, just to understand the pre-diabetes also better, what blood sugar levels is pre-diabetes diagnosed or classified as pre-diabetes? Also, what diagnostic tests are used to identify pre-diabetes? If one of our viewers is interested currently in checking this, how should they go about it?
Well, thank you for this opportunity. As said earlier, pre-diabetes is a stage where there is intermediate hyperglycemia. The blood glucose is higher, not high enough to diagnose diabetes, but higher than normal. The diagnostic criteria for diabetes is a fasting blood sugar of 126 or more, or a post-glucose or a post-food blood glucose of 200 milligrams or more. But the normal plasma glucose is a fasting blood sugar of 100 or below, and after glucose or food below 140 milligrams. So therefore, an intermediate range of 100 100 milligrams to 125 milligrams of fasting, and 141 milligrams to 199 milligrams of post-glucose blood sugar is an intermediate stage called pre-diabetes. There is another way, and that is looking at the glycosylated hemoglobin, which is a surrogate marker of blood glucose, and the range is, if it is between 5.7 and 6.4%, then you can diagnose pre-diabetes.
Right, Dr. Viswanathan, when should a person consider testing for pre-diabetes, and are there any specific symptoms that are uncommon and alert people to the risk that they could be, having a pre-diabetes?
Thank you for this very good question. Unfortunately, pre-diabetes is a very silent disorder. Many times diabetes itself is a silent disorder. So you should consider testing for pre-diabetes in people who are sedentary, number one. Number two, who have strong family history of diabetes. Parents who have diabetes, father, mother, or both parents diabetes. Third, if you have a past history of gestational diabetes, if you had diabetes during pregnancy and you had a big baby of more than 3.5 kgs, then it's a risk factor. So people who are sedentary, people who are older than 40 years, past history of GDM, gestational diabetes, if you have a sedentary lifestyle, and obesity, if you have a waist circumference, that is, if you put an inch tape around your navel, if it is more than 90 centimeters in men and more than 80 centimeters in women. So if you have any of these risk factors, as we call it, then you have a definite chance of getting pre-diabetes, and you should check up, as you heard from Professor Ramachandran, with a HbA1c test or a glucose tolerance test. Thank you.
Right. Now, Dr. Das, it's generally believed that once you have pre-diabetes, you will definitely, go on to developing diabetes. Is it always true, and can people do something to avoid it? If you could explain this to our viewers.
That's a very practical question. The answer is no. All pre-diabetics will not progress to full-blown diabetes if they take care. The seat anchor, the key thing to prevent pre-diabetes going into diabetes, is the lifestyle modification centered around diet, physical activity. Also today we include de-stressing and good amount of 7 to 8 hours of sleep. And with this physical activity, the body becomes sensitive to available insulin, and the weight comes down, and if there is a little bit of weight loss and the increase in the sensitivity, the pre-diabetes to diabetes progression is prevented. But I must add a word of caution that it is not possible for everybody to adhere to the diet and the strict lifestyle. Where we fail, the first, number one, number two, number three is lifestyle modification. If we fail, if the person has musculoskeletal deformity, cannot be exercised, today Government of India has approved a generic drug, metformin, which can be used, and it has been shown in multiple trials at home in India by Dr. A Ramachandran and also abroad, that dietary modification and the addition of this generic drug can prevent pre-diabetes going into diabetes.
All right, Dr. Ramachandran, can pre-diabetes also be controlled and managed without medical treatment? Can just modifying your lifestyle, is that sufficient to manage pre-diabetes?
Oh, that's a very good question. In fact, there have been a number of clinical trials, just like just now Das has just alluded to, both in India, called the Indian Diabetes Prevention Program, where we have recruited candidates with pre-diabetes and put them on a trial with lifestyle modification, which is dietary modification as well as physical activity. And if you are obese, reduction or reducing obesity goes a long way in reducing the risk of conversion to pre-diabetes to diabetes. So therefore, it is important that people with pre-diabetes should be tested for pre-diabetes, diagnose pre-diabetes, and then take up lifestyle modification, which is very simple. And dietary measures and improving physical activity is good for everybody, not only to reduce the risk of diabetes, but it can also reduce the risk of high blood pressure as well as cardiovascular events. Thank you.
All right, Dr. Viswanathan, if you could, tell us what type of food groups should be avoided if one has pre-diabetes, because that also plays a big role in diabetes and, whether it goes on to form full-blown diabetes. So what food groups should be avoided?
That's a very relevant question. I think the first thing is we Indians take too much of carbohydrates. So we Indians should reduce the carbohydrate intake. Now we must have carbohydrates for breakfast, for lunch, and for dinner, and in between if possible. So the carbohydrate intake should be very much reduced in people who are destined to become diabetic, who are in the pre-diabetic stage, which means that you should cut down the calories. Nobody says you should not take carbohydrates. You can take carbohydrates because we Indians are used to carbohydrate, but you should reduce the quantity of carbohydrate. We normally take about 65% of carbohydrates and rest all protein and fat. So you should reduce it to 50 to 55 grams, 50 to 55% of your total calories as carbohydrates. So cutting down carbohydrates means cut down on rice, rotis, and all the South Indian and North Indian dishes which have high amount of carbohydrate. Along with carbohydrates, we consume a lot of fatty food in India. So we take a lot of ghee and all the other substances which can lead to obesity. So I think it's very important to cut down the unnecessary fats, especially trans fat, and also reduce carbohydrate. So only then can you lose weight. By doing just exercise and eating a lot of carbohydrates, you will not lose weight. You should cut down carbohydrates, the total calories, and then do exercise for 30 minutes or 60 minutes every day.
And Dr.
Sweetened beverages should be avoided, and we don't take that much sweetened beverages as the Western countries. But even then, remember that sweetened beverages have empty calories and they only contribute to obesity. So you can take carbohydrates in moderation, but definitely you have to cut down carbohydrates, and you can cut down sugar, direct intake of sugar in coffee, tea if you have pre-diabetes. So these are the food groups which you should avoid when you are diagnosed with pre-diabetes or when you are obese. Thank you very much.
Right. In fact, Dr. Viswanathan, just to emphasize the role that food plays, if you could just tell us about how it's, because a lot of the Indian population, because people, are moving out from the poor bracket into, middle class bracket, and food habits are changing. And that is said to be one of the causes that we're seeing more and more, diabetes as well, especially in rural parts.
See, in rural parts, they consume a lot of carbohydrates. They take it along with fish curry or whatever. So I think it's very important to cut down carbohydrates, whether you are staying in the rural area or urban area. The carbohydrate intake is very high even in the rural areas. They take 1 or 2 square meals, and that has a lot of carbohydrates, rice in it or rotis in it. So you should try to cut down carbohydrates. So whether you stay in rural areas or in the urban areas, try to reduce carbohydrate. Take small frequent meals so you don't feel hungry. And take carbohydrates in 4 or 5 divided meals, not too heavy meals of carbohydrate with fish curry or some curry. If you're a vegetarian, you take some dal curry. So carbohydrate intake should be reduced drastically if you are serious about preventing pre-diabetes progression to diabetes. Thank you.
All right. Well, with that, we'll slip into a short break. We've spoken about the diet, the role it plays in diabetes. On the other side, we're going to talk about the role of exercise. Stay with us. Welcome back. You're watching Beat Diabetes, and today we're focusing on pre-diabetes. Before the break, we were talking about the role that your diet plays in whether you develop pre-diabetes or diabetes and how you need to cut out carbohydrates. But let's now focus on other lifestyle changes, and let's talk about exercise. Let's go across to our panel. And Dr. Das, what is the role of exercise in pre-diabetes management?
I think it's a very important question. being active, doing exercise, coupled with a balanced diet, can definitely prevent pre-diabetes going into full-blown diabetes. What exercise does are two important things. Number one, it increases the glucose uptake in the muscles. That is called glucose disposal. So the blood glucose gets neutralized. Number two, the sustained physical activity increases the glucose sensitivity. The muscles become sensitive to whatever insulin available in the body to respond to lower the blood glucose. Therefore, exercise works in both ways, insulin dependent manner and insulin independent manner, in building up the body which is pure from the point of view of high blood glucose and prevents pre-diabetes going into diabetes. All types of exercise, like the aerobic exercises like walking, swimming, dancing, are good enough. Even the strengthening exercises like bodybuilding, like weightlifting, they're also good enough. It has been shown by a balanced diet and this exercise, one can definitely prevent pre-diabetes going into full-blown diabetes. Apart from that, exercise gives you a great sense of well-being and keeps your life back into a very healthy lifestyle track. Therefore, exercise, to my mind, is of paramount importance for preventing pre-diabetes going into diabetes. It has been emphasized that one cannot forget to carry his legs. So even simple walking for 150 minutes a week, but that must be a brisk walking. 150 minutes a week is good enough exercise for a person.
All right, so that's important to keep in mind, and these lifestyle changes that are, so key to managing health. Dr. Ramachandran, are there any long-term consequences of pre-diabetes besides, of course, it developing into full-blown diabetes?
Yes, pre-diabetes is diagnosed because most of them have high blood glucose, but unfortunately, people with pre-diabetes also have a high risk of cardiovascular events like heart attacks and strokes in future, even before they develop full-blown diabetes. And the reason why they have this specific dose is because most of the people with pre-diabetes also have associated comorbidities such as hypertension, high cholesterol, obesity, especially with Dr. Vijay was talking about the central adiposity. In the Indian population, the risk of diabetes among pre-diabetes is much higher than in the white population or the European population. Approximately 50% of people will convert to diabetes in 3 years' time. Therefore, I feel that pre-diabetes does not mean just only just diabetes, but you also have risk of cardiovascular events. However, as both of them just now said, lifestyle modification, both simple dietary measures as well as improving your physical activity can immensely reduce the risk of not only diabetes, but also the risk of cardiovascular events in future. The good news is that the dietary measures and improving physical activity need not be very intensive or aggressive. Even if people do not lose weight, improved physical activity and simple dietary measures have beneficial effects. And another point, even if you take dietary measures and lifestyle modification for 2 years, that has got beneficial effects, extended beneficial effects up to 10 to 15 years. Your risk of diabetes comes down up to 2 decades if you do sincere lifestyle modification for 2 years. Therefore, lifestyle modification is worth investing if you have pre-diabetes.
All right, Dr. Viswanathan, another aspect, if we can talk about the weather and its impact, does hot or cold weather affect blood sugar levels, and can this then lead to misdiagnosis of pre-diabetes, and how can one detect such cases?
It's an interesting question. See, theoretically speaking, as the temperatures rise, the blood sugar falls and so on. There's explanation given like there's increased insulin absorption and so on. But what we see in practice is during the high temperatures, people take plenty of aerated drinks, the colas and all that, and they put on weight, and they get diabetes. So theoretically, yes, as the temperatures change, the blood sugars tend to change. But please remember, pre-diabetes is again not dependent on the temperature. It is dependent on the risk factors for pre-diabetes development. Is if you have a past history of gestational diabetes, pregnancy-induced diabetes, and delivering large babies, if you are having a sedentary lifestyle, if you are having a strong family history of diabetes, and so on, and if you are aged above 40 with a very sedentary lifestyle, then that leads to pre-diabetes and diabetes. Temperatures are not that important, though theoretically it is, but it is in reality it is not.
All right. Dr. Das, in women, is it common to get pre-diabetes during menopause? So is that something women need to watch out for? And why does this happen?
I think it's a very important question because I consider the female gender as the key to prevent diabetes, and to confide in you, diabetes is the mother of other non-communicable disease like hypertension, heart disease, stroke, etc. During menopause, because of two hormones, estrogen and progesterone, there are a lot of swings in the blood glucose. The blood glucose control goes a little bit difficult, and one may develop pre-diabetes. There are two important facts. The ladies who attain menopause early, that is between 40 and 45 years, the prevalence of pre-diabetes and following their diabetes is quite high. Even in the population, female population who attain menopause between 55 and 45, the odds ratio or the chances of getting the diabetes is about 60% higher. Now this can be prevented by balanced diet and good physical activity. I must hasten to add here that diabetes in women is different, it is difficult, and very often in our country, male gender dismiss it. They're often dismissed. Therefore, the female gender holds the key for preventing diabetes by obstructing the transgenerational transmission to the babies. And they are also the people in the house who organize the diet and the life centers around them. So we have to focus on the female gender for preventing pre-diabetes. And during menopause, the ladies also gain in the weight and also develop more of belly fat. And that makes pre-diabetes more conducive. They get pre-diabetes and diabetes. Therefore, preventing diabetes in the female gender and definitely preventing diabetes during menopause by physical activity, balanced diet, and absolutely good lifestyle is the need of the hour.
All right, so good lifestyle, good diet, as well as good physical activity and regular physical activity. Dr. Ramachandran, let's talk about stress now, because there's been a lot of focus on stress and the role that it plays in our overall health. And can stress then increase blood sugar levels and lead to prediabetes?
Yeah, I think that's a good question. We have found that stress is an important risk factor for all non-communicable diseases such as diabetes, pre-diabetes, hypertension, cardiovascular disease. And in our own studies, we have seen that when we did follow-up studies on people with pre-diabetes and then looked at their diabetes after 10 years, one of the important risk factors was events of stress in their lifetime. The other point is that stress that is occurring during the work time. For example, there is a large number of youngsters who are now employed in the IT profession, and they are under a lot of stress for two reasons. First, they have long hours of work, and secondly, they have difficult times to work. They have to work in the night for the American time. And we have found that there has been a higher incidence of type 2 diabetes among the youngsters who are IT professionals. And I feel that this is because of the increased stress in life they go through, and also the different timings and also decreased sleep they are getting because of the IT profession. You asked about temperature to Dr. Vijay, and that is a very good question. One of the important research that has been shown is that more than temperature, it is the air pollution in the cities. It has been found that in cities like Shanghai and Delhi, etc., where there is high air pollution, there is increased risk of what is called insulin resistance and metabolic syndrome. What is metabolic syndrome? I told you that in pre-diabetes, there is a clustering of cardiovascular risk factors such as hypertension, high cholesterol, and obesity. And this is called metabolic syndrome. And this is because there is a clustering of these cardiovascular risk factors to promote your risk for cardiovascular events such as myocardial infarction and also strokes. So air pollution has shown to increase insulin resistance in the body, and therefore it can actually prepone, actually people with pre-diabetes, conversion to diabetes can be increased, the speed can be increased because of air pollution.
All right. Well, thank you so much, doctors, for joining us on this very, very important issue. And as we said, diabetes is a ticking time bomb in the Indian population, and it's important that everyone take whatever steps they can to prevent diabetes and manage pre-diabetes. Thanks for watching. Goodbye.